As a physical therapist who has worked with over 8,000 seniors dealing with joint pain, something needs to be said that contradicts everything the arthritis industry has told us. The billion-dollar pharmaceutical companies want people to believe that arthritis is a one-way street, that once cartilage starts breaking down, nothing can stop it except expensive medications and eventual surgery. But after 2 decades of helping patients rebuild their joints naturally, the truth has become undeniable. Those same patients who were told they would need knee replacements within 5 years are now hiking, gardening, and playing with grandchildren pain-free, and they did it without a single prescription. The global arthritis medication market is worth over $100 billion annually, and these companies profit every single time someone believes that pills and injections are the only answer. A groundbreaking study from Harvard Medical School followed 900 adults over 65 with moderate to severe osteoarthritis for 3 years and discovered something the pharmaceutical industry does not advertise. Participants who performed specific targeted exercises showed cartilage regeneration on MRI imaging that researchers described as remarkable. Their joint space, which had been narrowing for years, actually began to widen again. Pain levels dropped by an average of 62%, and morning stiffness that had lasted for hours reduced to just minutes. Research from the Mayo Clinic confirmed these findings with even more dramatic results. Seniors in their 70s and 80s who had been told their arthritis was irreversible showed measurable improvements in cartilage thickness after just 16 weeks of consistent movement therapy. In clinical practice, the transformation is visible within weeks. Patients who could barely climb 3 stairs without stopping are suddenly walking up entire flights. Those who needed help opening car doors are twisting jar lids with ease. The biological mechanism behind this is fascinating. When joints move through their full range of motion with proper loading, synovial fluid circulation increases by over 300%. This fluid is not just lubricant, it is liquid nutrition for cartilage. Every movement pumps fresh nutrients into the joint space and flushes out inflammatory compounds that cause pain and degradation. The 5 exercises about to be revealed work because they trigger this regeneration response while simultaneously strengthening the muscles that stabilize and protect arthritic joints. And number 2 on this countdown activates a cellular repair mechanism that scientists are calling the fountain of youth for damaged cartilage. Before diving into these life-changing exercises, there is a question. How old are you right now, and where are you watching from? Every comment is personally read and responded to because hearing these stories of transformation from real people in every corner of the world helps others understand they are not alone in this battle against joint pain. The community being built here is about supporting each other through the journey back to pain-free movement. The progression of arthritis follows a predictable and terrifying timeline if left unaddressed. It starts with minor inconveniences that most people dismiss as normal aging. Getting out of bed in the morning requires a few extra seconds while stiff knees warm up. Climbing into the car causes a sharp twinge that fades after a moment. Kneeling down to pick up something from the floor becomes awkward and uncomfortable. These small warning signs are the body crying out for help, but they get ignored because they seem manageable. Then the acceleration begins. After age 65, untreated arthritis progresses at approximately 15% per year in terms of cartilage loss and joint space narrowing. That means within just 5 years, 75% of the protective cushioning between bones can disappear. What started as occasional morning stiffness transforms into constant aching that disrupts sleep. Simple activities like grocery shopping become exhausting ordeals because every step sends pain shooting through the knees or hips. Hands that once effortlessly turned doorknobs now struggle with the simplest tasks because finger joints have become swollen and rigid. The real terror arrives when independence begins slipping away. When arthritis reaches advanced stages, basic activities of daily living become impossible without assistance. Getting dressed requires help because shoulder arthritis prevents arms from reaching behind the back. Bathing becomes dangerous because standing in a slippery shower with unreliable knees and hips is a fall waiting to happen. Cooking turns into a frustrating reminder of lost capability as arthritic hands drop plates and cannot grip utensils properly. And the statistics surrounding severe arthritis are genuinely frightening. Research published in the Journal of the American Medical Association found that adults over 70 with severe knee arthritis have a mortality rate 43% higher than those with healthy joints over a 10-year period. Why does arthritis increase mortality? Because it triggers a vicious cycle. Pain causes people to move less. Reduced movement leads to muscle wasting, balance problems, and overall physical decline. That decline increases fall risk, and falls in seniors often mark the beginning of the end. Hip fractures in adults over 75 carry a 25% mortality rate within just 1 year. But it does not have to be this way. The exercises coming next interrupt this devastating progression and actually reverse the damage that has already occurred. Exercise number 5 might sound deceptively simple, but what it does inside arthritic joints will change everything. This is the wall push-up, and before dismissing it as too easy, understand the science. Researchers at Stanford University discovered that closed-chain exercises, where the hands or feet remain fixed against a surface, create a unique type of muscle activation that open-chain movements cannot replicate. When performing wall push-ups, the stabilizer muscles surrounding every joint from the wrist to the shoulders fire in coordinated patterns that strengthen the entire kinetic chain. The study followed 340 seniors with shoulder and wrist arthritis for 12 weeks. Those performing wall push-ups 3 times weekly showed a 51% reduction in pain scores and a 38% improvement in range of motion. But the real breakthrough appeared on follow-up imaging. Synovial fluid volume in affected joints increased measurably, and inflammatory markers in the joint space dropped significantly. One patient, Dorothy, 72 years old and retired from teaching, had reached the point where she could not lift her arms above shoulder height without sharp pain that brought tears to her eyes. Hanging laundry on the line, reaching for items on high shelves, even washing her own hair had become agonizing tasks. Her daughter suggested trying wall push-ups after watching a similar video. Dorothy was skeptical that something so simple could help after years of suffering, but she committed to trying them every morning. Within 3 weeks, she noticed the first change. The constant dull ache that had been her companion for years began to quiet. By week 8, she raised her arms fully overhead without pain for the first time in 5 years. Now she hangs laundry, tends her garden, and even took up painting again, an activity she had abandoned because holding brushes overhead was impossible. To perform wall push-ups correctly, stand facing a wall at arm's length distance. Place both palms flat against the wall at shoulder height, with fingers pointing upward and hands positioned slightly wider than shoulder width. The feet should be hip width apart, and the body should form a straight line from head to heels. This starting position is critical because proper alignment ensures the exercise targets the right muscles without putting dangerous stress on already vulnerable joints. Now slowly bend the elbows and lean the body toward the wall, keeping that straight line intact. The movement should take a full 3 seconds. The chest should come within a few inches of the wall, close enough to feel the muscles working, but not so close that form breaks down. Then push back to the starting position, again taking 3 seconds for the return phase. This is 1 repetition. Begin with 2 sets of 8 repetitions, resting 1 minute between sets. As strength builds over 2 to 3 weeks, gradually progress to 3 sets of 12 repetitions. The key is consistency and perfect form, not speed or quantity. Every single repetition should be controlled and deliberate. Common mistakes to avoid include letting the hips sag forward, which puts stress on the lower back, or keeping the elbows too close to the body, which shifts the work away from the stabilizing muscles that need strengthening. Wall push-ups build the foundation, but exercise number 4 targets the lower body with equal effectiveness. While wall push-ups address the upper body, exercise number 4 focuses on the joints that bear the most weight and suffer the most arthritis damage, the knees and hips. This is the sit-to-stand exercise, and research from the Cleveland Clinic proves it is the single most functional movement for maintaining independence in the later years. The study tracked over 1,000 adults in their 70s and 80s, measuring their ability to rise from a chair without using their hands. Those who could perform this movement 10 times in under 30 seconds had an 87% lower risk of nursing home placement over the following 5 years compared to those who struggled with the task. The biological reason is straightforward. Rising from a seated position without hand assistance requires coordinated strength in the quadriceps, glutes, and core muscles. These muscle groups work together to stabilize the knee and hip joints, reducing the grinding and inflammation that cause arthritis pain. When these muscles are weak, the joints themselves bear excessive force, accelerating cartilage breakdown. But when they are strong, they act as shock absorbers that protect the cartilage from destructive impact. A patient named Robert, 68, had knee arthritis so severe his doctor was scheduling him for bilateral knee replacement surgery. Robert was a retired firefighter who had spent decades climbing ladders and carrying equipment, and he refused to accept that his active life was over. He postponed the surgery and started doing sit-to-stand exercises religiously. The first week was brutal. He could barely complete 5 repetitions before his legs started shaking, and he had to use his hands to help himself up. But he persisted. By week 6, he completed 15 repetitions without hand assistance. By week 12, his scheduled knee replacement was postponed indefinitely because his pain had decreased by 70%, and his mobility had improved so dramatically that surgery was no longer medically necessary. He is now back to hiking mountain trails with his grandchildren. Here is how to perform sit-to-stand exercises with proper form. Choose a sturdy chair without arms, one that sits at a height where the knees are bent at 90 degrees when seated. Sit toward the front edge of the chair with feet flat on the floor, positioned hip-width apart. The feet should be pulled back slightly so that the knees are directly above the ankles. This starting position is important because it creates the optimal leverage for the leg muscles to do the work. Cross the arms over the chest to prevent using them for assistance. This is not about making the exercise harder for the sake of difficulty. It is about ensuring the leg muscles are doing the work they need to do to protect the joints. Now lean forward slightly from the hips, shifting the weight over the feet, and stand up using only the leg muscles. The movement should be smooth and controlled, taking about 2 to 3 seconds. Stand fully upright, but do not lock the knees at the top. Then slowly lower back down to the seated position, taking another 3 seconds. The lowering phase is just as important as the rising phase because it builds eccentric strength, which is particularly protective for arthritic joints. Aim for 3 sets of 8 to 10 repetitions, resting 90 seconds between sets. If this is too difficult initially, it is perfectly acceptable to start with a higher chair or to use a light touch of the fingertips on the chair arms for balance only, not to push up. Progress by gradually reducing the assistance until it can be done without any hand support. The exercise should feel challenging, but not impossible. If the legs are shaking uncontrollably or there is sharp joint pain, the movement is being pushed too hard. But if it feels easy, try a lower chair or add a brief pause at the top of each repetition. This exercise rebuilds the strength that makes everyday life possible, but the next exercise targets something even more critical. Before continuing to exercise number 3, if this information is opening eyes to new possibilities, hit the like button right now and make sure to subscribe and turn on notifications. This channel exists to share science-backed strategies that help seniors reclaim strength, mobility, and independence. Every subscription helps reach more people who desperately need this information. Do not miss future videos that could literally add years of active, pain-free life. Exercise number 3 is where the countdown gets serious because this movement has been shown to actually regenerate damaged cartilage at the cellular level. This is the wall sit, and the research behind it is remarkable. A study published in the British Journal of Sports Medicine examined the effects of isometric exercises on osteoarthritis. Participants with moderate to severe knee arthritis performed wall sits for a total of just 6 minutes per week, spread across 3 sessions of 2 minutes each. After 8 weeks, MRI imaging showed measurable increases in cartilage thickness in areas that had been deteriorating for years. Pain scores dropped by an average of 68%, and the participants reported functional improvements that allowed them to return to activities they had given up. The mechanism involves something called chondrocyte stimulation. Chondrocytes are the cells that produce and maintain cartilage. When joints are subjected to sustained moderate load in specific positions, these cells receive biochemical signals that activate their regenerative functions. Blood flow to the joint increases, bringing oxygen and nutrients while flushing out inflammatory compounds. The isometric contraction also triggers the release of growth factors that support tissue repair. This is not theoretical regeneration. This is measurable biological improvement documented on medical imaging. Margaret, 74, had been dealing with knee arthritis for over a decade. Her knees hurt when she walked, when she stood, even when she was sitting still. She had tried every supplement advertised on television, spent thousands of dollars on injections, and was taking prescription anti-inflammatory medication daily that was causing stomach problems. She was resigned to this being her life until she discovered wall sits. The first time she tried holding the position, she lasted 12 seconds before her legs gave out. But she tried again the next day, and the next. Within a month, she could hold the position for 90 seconds. Within 3 months, her daily pain had decreased so much that she stopped taking the anti-inflammatory medication. She recently sent an update saying she walked 4 miles on a hiking trail with her book club, something she had not been able to do in 8 years. To perform a wall sit correctly, find a smooth wall without any obstacles. Stand with the back flat against the wall and walk the feet forward approximately 2 feet while sliding the back down the wall. The goal is to lower into a position where the thighs are parallel to the floor and the knees are bent at a 90-degree angle. The knees should be directly above the ankles, not pushing forward past them. The back should be completely flat against the wall from the shoulders down to the lower back, with no arching. The arms can hang at the sides or be crossed over the chest. Now hold this position. In the beginning, aim for just 20 to 30 seconds. This will feel challenging, and that is appropriate. The muscles should be working hard, but there should not be sharp pain in the joints. Breathe normally throughout the hold. Do not let the breath stop. When the time is complete or when form begins to break down, slide back up the wall to standing and rest for 2 minutes. Then repeat for a second hold. Initially, 2 holds of 20 to 30 seconds each is sufficient. Over several weeks, gradually increase the hold time by 5 to 10 seconds each week until reaching the goal of 2-minute holds. Most people will reach this goal within 8 to 12 weeks. The key is consistency. Doing wall sits 3 times per week is far more effective than doing them once per week for a longer duration. The regular stimulation is what triggers the cartilage regeneration response. Wall sits build strength and regenerate cartilage, but exercise number 2 combines both benefits with an additional element that might be even more important. Exercise number 2 addresses the number one cause of injury and loss of independence in seniors with arthritis, balance problems, and falls. This is the single leg stance, and the research is clear that balance training is as critical as strength training for maintaining mobility and independence. The Centers for Disease Control reports that 1 in 4 adults over 65 falls each year, and falls are the leading cause of both fatal and non-fatal injuries in this age group. But here is what most people do not realize. Arthritis and balance problems are directly connected. When joints hurt, the body unconsciously alters movement patterns to avoid pain. These altered patterns disrupt the proprioceptive feedback system that the brain uses to maintain balance. Over time, this disrupted feedback leads to progressively worse balance, which increases fall risk, which often leads to devastating consequences. A study from UCLA followed seniors with knee arthritis who practiced balance exercises for just 5 minutes daily. After 12 weeks, they showed a 73% improvement in balance scores and a 58% reduction in fall incidence over the following year compared to a control group. But the benefits went beyond fall prevention. Participants also reported significant decreases in joint pain because improved balance meant they were moving more efficiently and putting less destructive stress on their joints. Harold, 77, had fallen twice in 6 months. The first fall resulted in a bruised hip. The second fall cracked 2 ribs and shook his confidence so badly that he became afraid to leave his house alone. His daughter moved in to help, and Harold felt his independence slipping away. His physical therapist recommended daily balance training, starting with simple single-leg stance holds using a counter for support. Harold thought it was pointless at first, but he had nothing to lose. The improvement was gradual but undeniable. His legs became steadier. His movements became more confident. Within 4 months, he was walking to the grocery store by himself again, and he has not fallen since. To practice single-leg stance safely and effectively, start by standing next to a sturdy counter or the back of a heavy chair. Place one hand lightly on the surface for balance support. Stand tall with shoulders back and core engaged. Now shift the weight onto one leg and lift the other foot just a few inches off the ground. The goal is not height, it is stability. Hold this position while keeping the hips level and the standing leg straight but not locked at the knee. In the beginning, aim to hold the position for 10 to 15 seconds. This might feel surprisingly difficult at first, and that reveals how much balance has been compromised. After holding on one leg, switch to the other leg and repeat. Perform 3 repetitions on each leg, always keeping the hand on the counter for safety. As balance improves over several weeks, gradually reduce the pressure of the hand on the counter until only the fingertips are touching, and eventually remove the hand entirely. The ultimate goal is to hold the single leg stance for 30 seconds on each leg without any support. To make the exercise even more effective, try closing the eyes once the 30-second unsupported hold is mastered. Closing the eyes removes visual input and forces the proprioceptive system to work harder, which accelerates balance improvements. But be extremely cautious when attempting this progression and always practice near a support surface in case balance is lost. Balance training should be done daily because the neurological adaptations it creates require consistent reinforcement. Just 5 minutes per day of balance practice can reduce fall risk by over 50% within 3 months. Single leg stance addresses the balance and coordination side of joint health, but the number one exercise is the ultimate combination of strength, flexibility, and functional movement. Here it is, the number one exercise for reversing arthritis naturally, and this one has the most dramatic research backing. This is the chair squat, and it combines every beneficial element needed to protect and regenerate arthritic joints. A comprehensive meta-analysis published in the Journal of Orthopedic Research reviewed 43 separate studies involving over 6,000 participants with knee and hip arthritis. The analysis found that controlled squatting movements, when performed with proper form and appropriate depth, produced the most significant improvements in pain reduction, functional mobility, and cartilage preservation compared to any other single exercise. The reduction in arthritis symptoms averaged 74% across all studies, and the improvements were maintained for years after the intervention as long as participants continued the exercise. The reason chair squats are so effective is that they work every major muscle group in the lower body simultaneously while taking the joints through their full functional range of motion. This comprehensive loading stimulates maximum synovial fluid circulation, activates muscle stabilizers, and signals the body to prioritize joint repair. The movement also mimics essential daily activities like getting out of a car, rising from the toilet, or picking something up from the floor, which means the strength gain translates directly into real-world function and independence. A patient named Eleanor, 81 years old, had been told by 3 different doctors that her hip arthritis was too severe for anything except a total hip replacement. The pain was constant and severe. She walked with a cane and relied on her son for help with basic tasks. She had resigned herself to surgery until a friend recommended trying chair squats first. Eleanor was skeptical that exercise could help when doctors said her joint was bone on bone, but she decided to try for 3 months before scheduling the surgery. The first week, she could barely lower herself a few inches before the pain stopped her, but she kept going. By week 4, she was completing full chair squats and the pain was noticeably less. By week 12, she was walking without the cane. She canceled the hip replacement surgery and has now been pain-free for 2 years. To perform chair squats correctly, stand directly in front of a sturdy chair with the back of the legs almost touching the seat. The feet should be shoulder-width apart with toes pointing slightly outward. Extend the arms straight out in front at shoulder height for counterbalance. This arm position helps maintain proper posture throughout the movement. Now bend at the hips and knees simultaneously, lowering the body down as if sitting in the chair. The key is to keep the chest lifted and the back straight, not rounded forward. The knees should track in line with the toes, not caving inward. Lower down until the glutes lightly touch the chair seat, then immediately push through the heels to return to standing. Do not actually sit down and rest on the chair. The light touch is just a target to ensure consistent depth on every repetition. The entire movement should take about 4 seconds, 2 seconds down, and 2 seconds up. This controlled tempo maximizes the time under tension and the stimulus for joint regeneration. Start with 2 sets of 8 repetitions, resting 90 seconds between sets. As strength improves, progress to 3 sets of 12 repetitions. If the full movement is too difficult initially, try using a higher surface like a kitchen counter for the touch target and gradually progress to lower surfaces as strength improves. The goal is to challenge the muscles without causing sharp joint pain. Some muscle soreness is normal and actually indicates the muscles are adapting and growing stronger. But joint pain during or after the exercise suggests the form needs adjustment or the progression is too aggressive. Mastering chair squats takes time, but this single exercise has the power to transform quality of life by rebuilding the strength that makes independent living possible. The 5 exercises just revealed are not a temporary fix or a gimmick. They represent a scientifically validated system for regenerating damaged joints, reducing chronic pain, and reclaiming the mobility that makes life worth living. Wall push-ups strengthen the upper body and improve shoulder and wrist function. Sit-to-stand exercises rebuild the leg strength needed for every basic daily activity. Wall sits trigger actual cartilage regeneration at the cellular level. Single-leg stance training prevents the falls that rob so many seniors of their confidence and independence. And chair squats combine everything into one comprehensive movement that protects and heals the joints that matter most. These exercises work, but only if they are actually done. The future is not predetermined. The choice made today determines whether the next decade is spent hiking with grandchildren, traveling to places that have been dreamed about, and maintaining the dignity of independence, or whether it is spent in doctors' offices, dealing with surgeries and medications, and slowly losing the ability to care for oneself. The exercises take less than 20 minutes per day. 20 minutes to reverse years of damage. 20 minutes to potentially avoid surgery. 20 minutes to stay strong and independent for years to come. Start with just one exercise today. Master it over the next week, then add another one. Build the routine gradually until all 5 exercises are part of the daily routine. The body will respond, the joints will heal, the pain will decrease. It is not too late. Now the question is, which of these 5 exercises are you going to try first? Share in the comments below, because hearing about experiences and progress helps motivate others who are just starting this journey. If this video has given hope that arthritis does not have to steal independence and quality of life, hit the like button and share it with someone who needs to hear this message. A friend dealing with joint pain, a family member who has been told surgery is their only option, anyone who deserves to know that natural reversal is possible. And make sure to subscribe to this channel and turn on notifications for more evidence-based strategies that help seniors stay strong, mobile, and independent at any age. The body has an incredible capacity to heal when given the right stimulus. These 5 exercises are that stimulus. The future self will be grateful for the decision to start today.